The shoulder is the most movable joint in the body. A joint injury or a degenerative process like arthritis will result in pain, reduction of mobility, and the need to see a physician. We spoke with Dr. Rishi Garg of Methodist Hospital in Arcadia, California, about the causes and treatment options available.
Shoulder injuries, it really depends on the age, and it's very prone to injury. It's a very shallow joint. There's not a lot of stability, bony stability, so there's a lot of soft tissue that holds the joint together. So because of that reason, all the ligaments and tendons and soft tissue are very prone to injury. Young patients seem to injure the ligaments more, and older patients tend to injure their tendons more. Over time, those tendons can start to degenerate. So it's not necessarily an acute injury as we get older. It's wear and tear, just like arthritis. The shoulder joint has a lot of cartilage in the glenoid and the humeral component, which is the ball and socket. And that joint can wear out just like your hip or knee. And that's the definition of arthritis, is when the cartilage, the soft cushion, starts to wear out. People usually come and see me when they can't take the pain anymore. Usually the pain in the shoulder depends on their pain threshold. Some people can take it for months, and some people come see me after a week, and they don't want to deal with it. The other thing is lifestyle. If they're very active, they're very athletic, weekend warriors, they tend to injure their shoulders fairly often, and they'll come see me right away. They want to get it fixed so that they can go back out there and play.
Dr. Garg discussed the methods used to diagnose the cause of shoulder pain.
The first thing we do in treating shoulders, diagnose the problem. Obviously, we get a good history. Where's the pain? How long has it been lasting? What makes it go away? What helps it? The second thing we do is a physical examination. We do various provocative maneuvers to help us indicate where the source of the problem is. And then we get x-rays, MRIs, further imaging studies, and diagnose the problem. Almost always, the initial line of treatment is going to be anti-inflammatory medications. That's true for a lot of orthopedics. We also like to do physical therapy for stretching, strengthening, and modalities such as electrical stimulation, heat, massage, ice, things like that. If that fails, sometimes we go to cortisone injections. It's basically an anti-inflammatory. And if that fails, then we start talking about surgery. The surgery could be one, arthroscopic. It all depends on the area that's the problem. Now, the most common thing I see is rotator cuff tears. That tendon degenerates over time and it'll tear. We do that arthroscopic now. Back in the day, they used to make a big incision, cut through muscle. Patients would stay in the hospital for a day or two. But because of modern technology, we can do it all arthroscopic, even massive tears. We can suture it down using bone anchors that have sutures attached to it and reattach the tendon back down to bone.
Dr. Garg went on to mention physical therapy.
For that particular type of surgery, there's two different schools of thought. Some physicians think you should get patients moving right away, where you start physical therapy right away and rehab them for about 3 months. There's another school of thought where it's thought we should immobilize those patients for about 4 to 6 weeks in a brace, which is basically a sling with an abduction pillow. And after about 4 to 6 weeks of immobilization to allow that tendon to heal, we then start physical therapy for about 3 to 4 months. So we're looking at an overall 4 to 6 month recovery. I can tell you rotator cuffs, depending on the quality of the tissue, the age of the patient, younger patients obviously do better. The more active athletic patients tend to do better. But overall, I'd say the success rate's about 90 to 95%. Same thing with shoulder replacements. When we do shoulder replacements, it's about 92% success rate.
And Dr. Garg has some helpful advice.
The best way to avoid a shoulder problem is just avoid overuse. If you find that you're doing some activity that's constant, repetitive, overhead, over-shoulder type motion, that rotator cuff will tend to wear and tear, the cartilage will wear and tear. You really want to avoid those activities. And if you start to feel pain, come see a shoulder specialist sooner rather than later, because there's things we can do to prevent it from getting worse.